We don't believe you can replace all in-person care with technology. There are certain patients who that will work for, who a virtual experience, an online PT and exercise program or coaching will work for, but there are folks out there who need both as well. And so it's really about marrying those two together.
Welcome to the Healthcare Grind, where we cut through the noise in the healthcare industry to bring you the latest trends, innovations, and insider insights. I'm Jess Hearthcock, and I'm joined by my co-host, Lon Hecht, as we embark on a journey to connect early-stage healthcare companies, payer executives, and investors with the knowledge and perspectives that matter most. Get ready to grind in the fast-paced realm of healthcare innovation. And for more advanced content, go to healthcaregrind.com.
Hi, everyone. This is Lon Hecht. Welcome back to the Healthcare Grind. It's great to have you here. Joined by my co-host, Jessica Hearthcock, and we have a great panel today. We're joined by the folks from Livara. We're going to be talking about musculoskeletal health, and we have Rob Cohen, the CEO, joining us, and Kam Raiszadeh, who is the Chief Medical Officer and co-founder. It's great to have you guys on the show today.
Thank you. Great to be here.
Thank you. So, you know what? We like to typically start off with maybe a 30 to 60 second elevator pitch. I think, Rob, you said you'd take that. Do you mind giving it a shot for us?
Sure, absolutely. Livara is a value-based musculoskeletal management provider. We've been around for about 17 years. We employ a holistic, multidisciplinary approach to ensure patients or members receive optimized and appropriate MSK or musculoskeletal care to improve outcomes, improve patient and provider experience, and reduce costs. Because we've been at this for so long and refined our clinical model over such a long period of time, we will take risk as well. So true upside downside risk on musculoskeletal spend for our patients, for our customers who are typically providers or health plans, and really ensure that they get those costs lowered while their patients experience much better care. We have an average NPS score among our patients or members of 94. And so we've really shown that we can really delight members while accomplishing our customers' goals. And that's what we're here for.
That's awesome. So you guys have been around a while, 17 years. Is that right? So
Yes.
Dr. Kam, I would love to hear the founder story. I think, being around for that long, there's a pretty big differentiator there. You guys have a lot of outcomes. You guys have had a lot of success, but let's take it back to the beginning for a minute. Tell us about the founder story if you don't care.
Absolutely. Yeah. No, I'm a spine surgeon by trade and starting in spine surgery now 27 years ago. I was trained in classically treating spine conditions like severe neurologic deficits, tumors, fractures, and the indications of surgery had changed over the years to where we started to treat back pain and neck pain with surgery. And there were a couple of innovations at that time that really sparked my interest in some ways, but also made me reconsider what we're doing, because there were surgeries, for example, putting in cages for discs that end up having a lot of complications, or where we used to do what was called an IDET procedure. And so these procedures, I was revising more and more. I was in an academic practice and revising these procedures more and more, where I looked at the fact that the first surgery was not indicated. And then this grew to the point where I really became interested in muscle physiology, because I realized that through my association with UC San Diego, that a lot of these patients that we were able to strengthen and get the muscle stability in the joint actually did not need surgery, even for classical indications, such as stenosis or spondylolisthesis, these conditions that are classically surgical. And this what led to some interest in a few IPAs in town, and one specifically, Sharp, wanted to do a trial with us because they had a problem with overutilization of surgery. And with exercise physiologists and me, we were able to decrease the surgical rate at that point with just these specialized exercises and confidence from the surgeon by 25%. And that was really the nidus that then built the clinics. And gradually these built out over a few years to now 10 clinics. But then over the past 5 years, the addition of a lot of the online and multidisciplinary psychosocial aspects have really led to us being able to cross all methods of utilization that the patient actually needs to meet them where they are and provide this service throughout. And then that's led to a bunch of other studies where we found significantly even more savings on total cost of care.
So you mentioned you have clinics, but I also believe that you serve patients all over the country. Can you tell us a little bit about your business model and give me an idea when you're outside of California, where your clinics are, how does the model work?
We operate a bit like a cross between a virtual orthopedic practice and a care management practice. We deploy really three elements to our solution. There's care planning, there's navigation, and there's care delivery. And that is delivered in a combination of virtual and in-person, through a combination of virtual and in-person sort of methods. Typically what we do is we receive patients in a variety of ways. We may receive them from primary care physicians, from analytics of claims data or clinical data. We're able to assess those patients and then really connect them to what they need after we've created that care plan. What we connect them to may be one of our own orthopedic surgeons for a consultation. It may be an advanced practitioner, a DPT, or we may put them through our own experience where we have a full virtual physical therapy, as well as a psychosocial approach where we have a variety of interventions around mindfulness, sleep, nutrition, alcohol use, all of these things that we have found have a big impact on musculoskeletal care. We deliver all that along with a coach that guides the patient, all overseen by PTs and physicians. And then we really monitor progress. And if patients aren't progressing, we round on them. So again, that multidisciplinary approach. And then we navigate them if they need to be into their local market. So if we need to navigate them to a high value orthopedic surgeon, one that has great outcomes, one that makes the right use of ambulatory surgery centers, if we need to get them to an MRI or a pain specialist, we do all that through these high value networks we build in the markets they're in. And so what we're able to do is take those clinics that we have in Southern California and export everything that we learn and all the innovation we develop there, export that out, even when we're partnering with other clinics in other markets. And so that's really the whole approach. And it's really proven itself in that we've generated on average, 40% cost of care savings, 35% reduction in surgery, huge increase in patient functional outcomes, reduction of opioid use, all sorts of really, really important outcomes.
So it sounds like there's a combination here of both this very personalized clinical touch, but then also a technology platform to deliver some of those services. Can you talk a little bit about that and maybe what percentages is what? Because it sounds like it's something that's really, really working today. And the fact that you also have those clinics kind of propels that model forward, that you have found this nice kind of secret sauce, so to speak.
Yeah, I'll touch on it. And Kam, I'll let you talk about it a little bit. I think, at its core principles, we believe strongly in a hybrid approach. We don't believe you can replace all in-person care with technology, right? There are certain patients who that will work for, who a virtual experience, an online PT and exercise program or coaching will work for, but there are folks out there who need both as well. And so it's really about marrying those two together. And when it comes to the physical therapy component of that, everything that we know and learn and continue to learn in our own clinics is what we're able to deliver, as we talked about before. But Kam, do you want to go into kind of that path a little bit more?
Yeah, exactly. As we know, about 10 to 20% of the population are the ones who consume 80 to 90% of the healthcare dollars. And a lot of times, if you are selecting folks who, for example, only come online or do not go in person to a doctor or to a physical therapy, you're missing out on affecting those patients' overall health. And I think that's really where, we've gotten to find risk factors that make somebody more inclined to come to clinic and need that one-on-one care. For example, if you have fall risk, for example, or there may be other aspects that make you more inclined to be online, whether you don't have access to coming to clinic as much, and also where your goals may be doing high-end exercises that you really require a lot more of a more online intervention of such. And then we also realized that patients need this psychosocial aspect woven in, where you only have a certain amount of bandwidth to do between your work and your social needs to be able to do your exercises. So we've been able to also titrate that for the needs of that patient, be able to select what risk factors we need to address most importantly, and be able to get that within usually as much as we can online and at home. But if we need to, then subsection that out into an in-clinic visit.
So really interesting. So thanks for sharing that. So just want to understand how patients end up in the funnel. So it sounds like some may come from a PCP referral. Others may be mined from claims data, maybe that are showing that they have some kind of issue and you're doing proactive outreach. Is that correct? And then what other ways are they kind of coming into the funnel? And how are you working with these PCPs?
Yeah, that's correct. We do have other methods. At times we work with utilization management providers in a variety of ways. At times we'll be upstream of the where we're using that claims and analytics. There are other times when it's actually a prior auth request that will trigger a referral to us. So, hey, there's a prior auth request for surgery or an injection or PT, and then instead they send them to us, where we're able to intervene. And then also that there may be promotions, let's say to a health plan's membership, an email campaign where members can then self-select and self-register with us if they think they could benefit from the program. And so, there will be others in the future. Those are the four main ways today. When we work with PCPs, what we find, it's interesting. I think when I've been here almost a year, and one thing I didn't expect, there are pretty much, I think, two main value propositions when you think about to PCPs and PCP groups. One is obviously the improved patient care and the reduced costs. The other one that I wasn't necessarily as in tune to before I got here was at times we call ourselves sort of the easy button for MSK. And these conditions can be a major challenge for PCPs. They're often not particularly trained in diagnosing MSK issues. They don't exactly know what the next step is. That's part of the reason for some of that unnecessary care or unnecessary procedures. So they may send to an MRI when one isn't really needed, or they may refer somewhere else when it's not really needed. And just by referring to us, we take that over. We have our experts that can determine the right path for the patient. The other thing that happens is that when PCPs then refer patients out to, let's say, to PT, the patient may attend PT 2 or 3 times, decide it's not working that well, it's not really that well connected with the rest of their care team, and the patient will just go back to the PCP and say, I've still got pain. And now the PCP has to make the referral and the referral and the referral. And so they end up having to deal with this a lot, whereas typically one referral to us, and we've got the rest of that patient's MSK journey.
So are they often, are any health plans kind of using you in lieu of utilization management? Is it one where maybe there's not a prior authorization required, or is that something that you would like to see them do?
We're not replacing utilization management right now. I think what a lot of our customers find is that it is a better approach when it can be utilized. So as I mentioned, sort of that patient NPS before, we provide a great experience for patients. I think most people would say that is not a great experience for providers or patients. And so we're able to, when we can get ahead of that benefits everybody. We're not replacing it yet, but I think there's a day in the future where there's a different version of utilization management that operates a little bit differently than today. Go ahead, Kam.
Yeah, and also I find as a clinician, patients really will make the right decision if they are provided the information fully. And I feel like that's a big difference between the paradigm of a utilization review saying, we're the expert, we're going to tell you what we we don't want you to do, or we're going to deny care, where then a patient's then stuck on, well, maybe I really need this. Maybe maybe I'm being denied something that would make me better. And then that's when they focus on their abnormality a lot more. Also, tying it in with an expert. One of the big things that we do is that we have both surgeons as well as non-operative physicians to be able to speak directly to those concerns. Because a lot of folks will look at a radiologic abnormality and pin their hopes on the fact and pin their pain on the fact that they have this radiologic abnormality. And you have to hear a lot of times from different aspects, but really from a definitive source like a surgeon saying that this radiologic abnormality does not require you to have surgery. And look at what will happen downstream. You may get a short-term improvement from the surgery, but look at the other side effects that can happen. We can only do so much with surgery that doesn't affect the normal biology of the body. So if you can fix it without that, you're going to be better off. Patients will make the best choice themselves then.
And Dr. Kam, you may have already said this earlier, so I'm sorry if I missed it. What percentage of surgeries are you preventing in getting that patient to the right care at the right time at the right place, so you're able to kind of streamline their path and it's a win-win for everybody? But do you have some of the statistics you can share about the big impact that you're making?
Oh, absolutely. Regarding spine surgeries, we save about 65% of those from happening. And this is pretty much in line with a lot of studies that have come out where they have quoted around 50% or greater than 50% of surgeries that are currently performed in the spine are unnecessary. This is the similar stats for total knees and total, especially total knees, where the stats are around 35 to 40% unnecessary surgery. So given this model, yes, there's significant savings.
So you mentioned that you're willing to do typically full risk. Does that mean some sort of upside? I know you said there's upside downside, but are you taking full capitation, or are you taking some kind of PMPM and there's a shared savings component or downside component to it?
Sure. We're essentially taking subcapitation. So if you think about either a health plan or a medical group that is delegated total cost of care, we will come in and we will subcap the MSK spend, set it at a certain level, and then we will take upside downside on that spend.
Okay, got it. And can you, I'm very familiar with subcap, but we do have some early stage entrepreneurs that come on and listen to the show. Could you explain subcap in 20, 30 seconds if possible?
Sure. We, along with our partner, will analyze the historical data. So first we'll define the codes that make up MSK, right? So if it's 10,000 codes, and these are the codes that we are now responsible for. We will run historical data. And so over the last 3 years, 2 years, 1 year, here was the total spend of those codes across your entire population, not just people that had an MSK, but just across your entire population. On average, it is $125 per member per month across your whole population. And so then we say, okay, that we'll lock in a baseline. We'll trend it forward. You would expect next year it'll be 130 if it was 125. And now we will measure ourselves against that. And that is how you really determine, okay, well, if costs went up the next year, then we have to take responsibility and are at risk for some of that. And if it, of course, below, then there is savings. And then that's where we can share the savings with our partner or customer.
Great explanation. Really appreciate that.
That was very good. Can we talk about customers? Because I know you guys have some pretty fantastic customers and partnerships that you've worked to secure. Can you tell us about some of the results you've seen with them and where you're serving members at? How many members across the U.S. are you serving today?
Sure. Kam, you kind of led this thing from the beginning. Why don't you talk about our history with some of those great customers?
Sure. Yeah. So Sharp Community Medical Group, which is a very well-known independent physicians association we've worked with for years, and then Scripps also in San Diego, also a very well-known group. We have a 2-year total cost of care study with them where we have saved 35% on total cost of care with that group. And then we have a group up in Orange County, Providence, that we work with, where we're more integrated with them with their electronic medical record to the point where we're actually the ones who can order the radiologic study or injections or surgical consults ourselves. And in that group, we have saved 45% total cost of care. So that's an exciting hybrid model. Then as far as a totally virtual model, we work with Carelon in 14 states. And with that group, we don't have the kind of total cost of care savings because it's a little different group to be able to compare to, but we do work with a large employer in California, and they're a dispersed group, CalPERS, and with them we have also saved 25% total cost of care. So we do have studies across these different providers. And Rob, any other ones you want to talk about?
I would just say in total we're serving about 4 million members across the country.
That's fantastic. And I'll tell you, if you have, I know you mentioned a study, that first one, I think it was 35% savings. If you do have it and you have it handy and you send it over before we upload this episode, we're more than happy to link it if you'd like us to. So just let us know on that one.
Absolutely.
So I think any payer would be really happy with 25.
Yeah, I think they'd be pretty excited to see that.
It's pretty fantastic.
Question for you. There's a lot of noise in the MSK space. You guys know this as well as anyone else. I can hear some really critical differentiators in your model versus others, but could you maybe take it a step further? I can think of 2 or 3 things right off the top of my head that set you completely apart, but could you take a minute and share with the audience?
Sure. And I kind of went through this exercise myself when I was deciding whether to come here a year ago and became pretty convinced of our differentiators. I think if you look at the MSK space as it's emerged over the last few years, kind of the first generation were what I would really call virtual PT, virtual physical therapy providers. And there is an element of virtual PT and hybrid PT in our solution, but it is much broader than that. And so I think that is maybe, broadly the key differentiator. If you start to dive down much deeper, I think it's really the clinical depth of our solution, the involvement of surgeons, the involvement of other physicians, the time we actually take to speak directly to the patients, assess the patients, and the level at which we monitor their progress and then navigate them into the local market through those high value networks that we form. And so if you think about those elements that I outlined, the care planning, the navigation, and the care delivery, the care planning is obviously extremely necessary to understand what a patient needs, and we're able to go really deep with that through the different and multidisciplinary clinicians we connect people to. Navigation is really important to get people to the right place and the high value specialists, but it's not enough, because if that's where you stop, what you're missing is the ability to actually avoid a lot of those. So you maybe get them to the low cost MRI center, but what you're missing is all the people that shouldn't have gotten the MRI at all. And so that's where some of that care planning comes in. And then on the care delivery side, I think there's a few differentiators that we have. One is the fact that we have clinics that we've been operating for almost 2 decades. And we, and Dr. Raiszadeh could certainly speak to this. We certainly have learned and understand and evolved over that time the model of care. And at this point, we've made a lot of mistakes in 17 years that now our customers can take advantage of those mistakes without having to live through those mistakes moving forward, right? And so we've really evolved that, and that's how we've really delivered the great outcomes that we have.
Yeah, and I'll add one other differentiator I feel like is really important is the fact that we as a group meet a lot where all of our practitioners understand what other folks do. Now, this is really important. When you're a patient and you come into a certain paradigm, let's say you go into just therapy, you're always questioning yourself, do I need an injection? Do I need something else that they're not providing? We actually will sometimes hasten somebody to get that injection or hasten somebody to have surgery at the right time. And that's really important for all of your practitioners then to understand the breadth of what you provide. And I feel like that's really what we do well that gives the patients the confidence that now I'm coming, it's a one-stop shop. I don't need to keep searching, and I will get what I need by this. So it's not just about preventing care, it's also the right care at the right time.
Makes sense. Jess, this has been a great episode. Do you have any questions that you'd like to ask before we wrap up in just a moment? I have one more for them, but
I have one more question.
Go ahead.
And that is, where do you see Livara going next? What's that next phase you want to accomplish? Because, it's been so great talking to you guys because, a lot of the startups we interview, they're new. It's very, they're running at 1,000,000 miles a minute. And it's cool to get to hear how your solution has evolved over 17 years and how you're pulling from that. So I know you're on a fast trajectory right now. What's next?
I'll comment and then Kam let you add anything you'd like. The first thing is we've got to impact more patients. We've got to bring our benefits to more patients and lives and members. I mentioned kind of that 4 million number, and but there are over 300 million people in the United States. In any given year, 20% of the typical population has an MSK claim, so has an issue, and that's not to speak to all the others that don't have a claim but do have MSK issues. So there are a lot of people out there we've got to get to, and we've got to help. I think that's the first part. I think the second part is clearly continuing to take advantage of emerging technologies. We do use AI in some of what we do in the virtual PT experience. I think there's an opportunity. One of the major things I think that technology in healthcare can help us do is be there even more for patients exactly when they need us, right? And so to the extent you can monitor their needs, you can check in with them frequently on an automated basis and then deliver to them what they need on an automated basis. That just extends what our humans are able to accomplish. And then 3 is just to continue to evolve and refine the clinical model and expand through all of the research that we do internally, continue to identify what's going to make our solutions better and our impacts better.
That's great. Dr. Kam, anything extra from you?
No, I think you really hit all the main points. I think the last thing I would add, just making sure that we have a very systematic approach to this, to where we are translating all the benefits that you get in person to online and vice versa. That's really the main. I think that's also an area where I feel like patients can then feel comfortable that they're not missing out if they are coming in on an online platform, that they really have access to everything.
Yep, absolutely. With time in mind, I'm actually going to hold to my question, but I will ask this. What's the best way for the audience to get in touch with you? If it's LinkedIn or it's email, whatever it may be, why don't you just spell your name so that folks know how to get in touch? Rob, why don't we start with you?
Oh, sure. So www.livarahealth.com is our website, and you can certainly kind of fill out a contact form on there. You can read more about us and then fill out a contact form on there. We do have a LinkedIn presence, which again is Livara Health, Livara being Livara. Those are probably the two primary ways of keeping tabs on what we're up to, as well as getting in touch with us.
Great. Anything to add, Dr. Kam?
Nope, that's it. Sounds great.
Okay. Well, we want to thank you so much for joining us. This has been a great episode. Really appreciate it. Please hit subscribe. And if you'd like more advanced content, go to healthcaregrind.com and subscribe over there. And thank you again for another great episode. Everyone have a great day.
As we wrap up this episode of the Healthcare Grind, we want to thank you, our incredible audience, for tuning in. If you found today's insights valuable, don't forget to hit subscribe and leave a review on your preferred podcast platform. Your feedback fuels our grind. For more exclusive content and updates, visit our website, healthcaregrind.com. Until next time, keep grinding, stay informed, and lead the charge in shaping the future of healthcare. This is Jess and Lon signing off from the Healthcare Grind.